health information management. We're starting a new program, surgical technology, and then I'm sure you know of nursing and then dental hygiene as well. I teach in the pharmacy technician program, and I'm also a dental hygienist. And Olga, who will be coming, teaches in the health information management program. So I have a quick video to show you that just kind of shows you what each of the different careers, their role in like a medical emergency situation. So I'll play that while we wait for Olga to get here, and then we'll have some more information for you.
Hi, you know your name? No? You know what happened? No? Can you tell me what hurt? So you've been in an accident. We're gonna take you out of the car.
You were in a car accident. We're going to take you to the hospital, okay?
This is Medic 1601 with a Code 3 radio report. I am en route with an 18-year-old female who's involved in a motor vehicle accident. She has lacerations to the face, a possible fractured wrist, possible fractured ribs. ETA 15 minutes.
Jasmine Ross, student nurse at Clark College. How can I help you? Okay, we have an 18-year-old female involved in an MVA, possible head lacerations on the left side, and right wrist involvement, and involvement in the abdomen. And she's coming in C-spine precautions, and your unit number? Okay, perfect, 1601. Thank you so much.
Great job, Jasmine. So we've got a case coming in. Let's go get the room set up and get everything ready to receive the patient.
I'm gonna count on 3. 1, 2, 3.
What are the vitals?
The vitals are 140 over 90. Her heart rate is slightly accelerated.
Why don't you get another set of vitals on her? Let's get another blood pressure.
Okay, I'm gonna do an assessment on your eyes, okay? Just look at the bright light for me. Just look forward. Yes, thank you. So, what is your name? Jill. And do you know where you are right now, Jill?
Yes, you're at the hospital.
Okay, I'm
written into it?
Yeah.
Awesome. Do you have your insurance card and ID with you? Perfect.
Ready to go?
Yeah.
It's been amazing witnessing the care and collaboration from all the healthcare providers. All the programs are so interconnected, and I really felt their passion for care.
So that just kind of gives you guys a good idea of all the different roles that healthcare providers play. Olga is very.
I'm here at last. Hi. I'm a little bit of a direction challenged, I guess, this morning. Thank you, Christina. Well, I'm sure you guys have saw the fun video we had up there. That was a collaboration we had with multiple different programs at Clark College, and it was supposed to just give you kind of a show of how everybody works together in the healthcare. Realizing that you're not going to be siloed, even if you're going to be working as a phlebotomist or if you're working in another area. So today, I guess first off, I want to know how much time I have.
20 minutes.
Oh, see. 20 minutes.
So this class period ends at 10:24, and then the next one starts at 10:29.
Okay, well, keep me on track.
Okay.
And then, did you have anything else you wanted to add?
I've just kind of gone over a brief description of the different programs.
Okay, well then I'll jump in and kind of explain, and then hopefully we can answer questions, and then I've got some goodies. If you can answer questions, I can give you some things. Alrighty, how about that? Does that sound like a pretty good deal? Alright, so this is going to be interactive a little bit, but first off, I'll just give you a quick explanation. So the main programs that were portrayed in the video, can anybody tell me at least one that they thought they saw there? Raise your hand, the first one to raise their hand can tell me what it is. Go for it, what was it?
A phlebotomist?
Phlebotomist, alrighty. You gotta choose, what would you like? I'll give you these choices here. Phlebotomist is correct. Another one, go for it.
The pharmaceutical, like medication.
Pharmaceutical, that is correct, but let's now get into the exact correct field that we have at Clark College. What would it be called? Pharmaceutical, you work either at Walgreens, you can work inside the hospital, like that person was portrayed them working in the hospital, doing the IV mixing, but as well, they were portrayed giving medication that was prescribed by the doctor, that was then put together by the pharmacist, and then delivered or given through the window by what we call a pharmacy technician. So that's two. What's the other one that you saw there?
The first one.
The first one. Woo! What drives a nice van?
An EMT.
EMT, yay. Okay, that's the third one. EMT, we have an EMT program as well. The EMT program is not on our main campus, however, you will take a couple prereqs. It's a very short, it's one of our shortest programs, along with the phlebotomist. But that program is actually at a training center with the fire department. A lot of fun. It's a great field to get into if either you're thinking about just maybe I want to do healthcare, maybe not, because it's short enough where you get a good feeling. It's also a lot of adrenaline rush. You're working as the frontline people, so you're going to be delivering care to the most traumatic or trauma areas, so make sure you're not squeamish. You better like blood, and you better like all kinds of other things, and elderly people, because when I used to work in long-term care, one of the ways we got people off the floor at night when you're the only nurse or the only caregiver there is, what do you think? We called the EMT, and they would come, or the fire department, and help me lift a 300-pound person off the floor back on the bed. So, gotta like people, all right? And so that's, okay, we've got 3, EMT, phlebotomist, and pharmacy technician. What were the other couple ones?
There's a nursing assistant.
There, a nursing, kind of like a nursing assistant. Let's try that. That was close, but not necessarily a nursing assistant, but you almost have it there. Go for it.
Medical assistant?
Medical assistant, that's right. So the difference between nursing assistant and medical assistant, that's great. So nursing assistants usually are caregivers, what we call, they're called CNAs, certified nursing assistants, or sometimes they give them different levels depending if they're working in the hospital. A certified nursing assistant could work at different levels in the inpatient side of the healthcare, as well as they work in the long-term care. Inpatient and outpatient is slightly different. Inpatient means hospital, where you get a room and board and some kind of food. You're staying there at least one night. That's inpatient. Now, you can also show up to the hospital just for a quick, let's say, scan, or maybe you show up because you have a one-day surgery. That's not necessarily called an inpatient. That could be, or what that is an outpatient. Now, in outpatient clinics, especially the ones that are not necessarily with hospitals, because we don't see as much medical assistance, like you mentioned, in the hospital. We see them mostly working in outpatient. And they help with checking patients in before the physician comes to talk to you. So how many of you have ever visited the hospital or healthcare? Just anybody. That should be everybody's hand. I hope all of you've been somehow in the hospital, unless you were born at home. Sometime in your life, you should have been in the healthcare. I should be seeing both hands up. But here's another thing. So in the outpatient side is where you have the opportunity, let's say if you're just getting a regular checkup. You come in, there will be a medical assistant that will bring you in, check you in, ask you multiple questions, and then they will pass you on to the physician. When the physician comes in, the medical assistant oftentimes will still stay in the room. Sometimes they don't, but sometimes they do. And they're now becoming the transcriptionist. So this is what leads to the next kind of field. So medical assistant, and then the people who do administrative tasks. How many of you remember that name or that title? If you do remember it, raise your hand. We got prizes for you. Fun prizes. Anybody remember the gentleman that was there? Somebody who hasn't maybe answered and can help out their teammate or their classmate by telling them, whisper, this is what it is. You have an idea there? No, you don't even want to guess? Just give it just anybody. Give a guess. Throw something out there. A technician, and give it another word before that. A technician of what? So this is in the administrative side. They don't do necessarily patient care. They're doing the electronic side. Yeah, checking them in. So the fancy name for it, and you can choose somebody to maybe give them a prize. Maybe should we be? We'll make this a very fair deal. You know, everybody gets a prize. But it's called Health Information Management. So at Clark College. Now I have 4 of these. Actually, you guys missed another 2, I guess I should say. One that's not portrayed in there, but one that is portrayed. And they would do the IVs. If you saw them, there was a couple of them by the bedside, and they helped with IV placement as well as assessment of the patient when they came into the emergency room. They were dressed in these nice blue scrubs, white robes. Anybody remember? It's a field that we all know about. And there's always a shortage of them. I heard it, nursing. Nurses, exactly, nurses. So another, I think she just, it's a couple prizes, there you go. But nurse is another one, and then one that wasn't mentioned in the video was dental hygiene. So if you're thinking about all the fields that we have at Clark College, is dental hygiene, nursing, then we have EMT, we have phlebotomy, pharmacy technician, medical assistant, and health information management. Those are the healthcare fields we have at Clark College that currently are there. We're also in the process of launching a surgical tech program, if you're interested in kind of going that route. How many of you have heard of what surgical technicians do? Maybe? What do they do? Go for it, just with surgery, that's exactly it. So a physician, let's say, is doing a major brain surgery, they're gonna need more than just a nurse there. They're also going to need somebody that assists them with giving them the proper equipment that they pass on during that surgery, as well as assist with robotics. So sometimes you may have a physician sitting behind a window, and then they are, the surgical tech is right there where the surgery is happening and assisting with a lot of the things that are happening in there. Go for it, did you have a question?
Yeah, what's the difference between that and a scrub?
And a scrub nurse. Ah, that's a good one. So a scrub nurse is just a specialty. So for example, I have a cousin who works in OR, and so she would scrub in to surgery. That means she's gonna get all cleaned up and she's in the surgery assisting. Now each of them will have a different role that they play in the surgery. For example, a nurse could be the one that calls the place. They can even help with IVs. A surgical tech can't do that. So a surgical tech can't place an IV in there. Certain medication delivery, surgical tech cannot deliver medication. A nurse can deliver medication. So there are huge various differences on the legalities and the licensure ability that they can do. So when a nurse, for example, it's the same thing as we think about the differences between a medical assistant and a nurse. Medical assistants, certain kinds of, for example, vaccine shots they can help with and they can deliver those, others they can't. We even have pharmacy technicians now that can deliver that too. So it just depends on the level that they've received. The nurses usually are the one that will deliver medications, and they have a different role or a specification that they're gonna lead in a surgery. But usually in an inpatient surgery, or even in an outpatient surgery, you'll have a nurse there. You will have a scrub tech or what we call a surgical tech, and then you'll have a physician who's performing the surgery. Nurses oftentimes also assist with getting people out of the anesthesia, watching for their breathing, vital signs. They're right there, sitting there, and they'll call a doctor if there's necessary need for that. So yeah, that's a good one. Any other questions that we might have? Go for it.
Do you guys do like a lot of job shadowing in your programs?
Job shadowing. So what we do in a lot of our programs, every program is slightly different. I teach in the health, so my background is in the administrative side, even though I did do a little bit of like the nursing assistant caregiving when I was in, actually in high school, the end of my high school. And then when I went off to college and university, I did do part-time caregiving. And, but my degree and what I worked in mostly is health information management. So in regards to your question was, do we do job shadows? Each program is slightly different. Most of the programs do have what we call an internship that you have to go through, and there's a certain hours. But there may not be necessarily a job shadow where like throughout the program you're gonna be shadowing somebody. But for example, health information management at the end of their program requires you to do 120 hours. Medical assistant has that too. Pharmacy technician, as well as phlebotomy has a certain amount of hours you have to do out in the field. So you actually are going to practice some of the things you learned and be able to do it. Nursing have multiple different times throughout their program where you have to do actual internship and work. For example, the dental hygiene, we actually have a clinic, dental hygiene clinic, on the campus of Clark College. And by the way, it's open to the public, anybody can show up there and get a checkup and see if they qualify to get care there. But that's a neat thing, and it's right there on the main campus, so especially for those that don't have maybe a dental insurance. And I'll be first to say that when I was a student, I did not have dental insurance. I had medical insurance, but no dental. And so I utilized when I lived in Seattle, I Googled all the dental hygiene programs locally, and that's where I got my teeth cleaned, was at the schools. So again, that's some of the ways that students get training, and very good qualified training, so that they can go see that. So yeah, there is, but not if you're just thinking of shadowing. The other thing, if you're gonna be a running start student, or if you're coming in first year into the college, you're thinking about going into the healthcare, you're just not necessarily sure which area you wanna go into. One of the classes that we have as a prerequisite in what we call the allied health. Allied health doesn't necessarily include nursing and dental hygiene because their prerequisites require them to take biology. Allied health, we have our own anatomy and physiology. And in allied health, we have a course that's called Health Careers and the United States Healthcare. And so in that class, we take one term to talk to you about the different areas of healthcare, different careers. We invite speakers to come into class and talk about the different areas of healthcare that are not even at Clark College. And then you have these 3 assignments. One of the assignments is to do an informational interview of the field that you're interested. So an example of that, I had once a student who was really interested in healthcare, at least that's what I thought, but in the end they wrote me a report about becoming a mortician. I was like, oh, okay. And so they've done enough research, and so the 3 items that the assignment is do the research about the career that you want to, then you have to do an informational interview, and then the mission and vision statement of what you want to do. So kind of those things. So you do get lots of opportunities to explore, hopefully, the field and understand a little bit more. Yeah.
When you were playing the video, I didn't see anything about surgery. Do you have any classes or anything about surgery?
Yeah, so the only thing, we have nursing. So nursing, obviously if you go into the nursing, you are going to have I want to say they almost have a whole quarter that's all about nursing and the surgery. And then the other one I mentioned, it's not in the video because it's a new program that's literally just launching this coming fall. And I think although the announcement had been already released in the Columbia, we are going to have a surgical tech program. So that's the only one. But when that video was done, this was during, I want to say COVID 2020. I think it's 2020.
You're in it.
Yeah, I know, I'm in it, that's true, so yes. So a little bit, let's see what else I can mention about some of the fields, and let me see if I'm running out of my time, or I have a bit more. I have 3 more minutes. All right, so one other thing to think about, so again, medical assistants, you'll see them in outpatient. Pharmacy technicians, you will see them in both inpatient, and you'll see them outpatient, as well as you'll see them in Walgreens or Fred Meyers. And I would say pharmacy technician, and Christina can probably speak a lot more about that because that's her field, but during COVID times, that field has really grown, and there's a lot of opportunities provided there.
You can work from home for insurance companies. I think a lot of people avoid the medical places. They think they don't want to touch blood or see blood or needles, and there's different programs. Pharmacy technician, you don't have to touch patients, you don't have to see blood or anything gross. Same with health information management. Just don't let that fear of blood or needles kind of deter you from a healthcare field. I have some friends that are pharmacy technicians that work from home for insurance companies, and they just love it. You don't have to deal with patients or blood or anything.
Yeah, and with health information management, one of the things to think about it is that it's a complete administrative side of healthcare. So we've got people that sometimes, nursing is the only thing they think that's out there, and then they feel like, oh, you know what, I just learned something else. When I went into healthcare, that was my original path. Was out of high school, I had this big billboard that I built for my last capstone project. I don't know if high schools have capstone projects still, but I'm dating myself a little bit here. Anyways, and we had to present on our career. My career was I'm going to be a physician assistant. I'm not a physician assistant. I'm in health informatics and health information management. So somewhere in that path of a physician assistant, I ended up on the administrative side. The administrative side is great because you can choose different paths. For example, I could go into the legal side. If I like computer systems, we need people right now in the healthcare to provide security in the healthcare. Do you know how much attacks there are daily, and ways of either internally where the employees improperly use of their passwords, or looking up what they shouldn't be looking up, or checking on patients that they shouldn't be. So there's a lot of protection that's required. And those are all jobs that are in the healthcare side of administration and to run that. One last thing, Becoming a penguin, you're a penguin forever. So just join us, and you'll have a great time.
I have one last question. So for them, it might be on those papers you're about to give out to them, but is each pathway kind of laid out for them, the classes that they need to take for each occupation, or?
Yes. So the number one, what I would say, each of these, we do have a QR code, and it's going to lead you straight to the page of that field, or the career that you see written. However, if you take one step back before that page at Clark College, it will show you all of our healthcare programs that are listed there, and if you click on each individual program, you'll be able to look at the classes there. So my recommendation, if you already know which exact program you want, connect with an advisor, go to the information session, start working towards that field. That can be right here in high school. Start taking all those anatomies, chemistries. When I was thinking of going into nursing, I will tell you, one thing that helped me with my chemistry, even though I am more of a math person, or I do enjoy that side a little bit more, is my chemistry teacher in high school. I don't know why, but she sat with me because I was a Running Start student, and I would bring my chemistry work from Clark College and sit with her, and she would talk to me about it. So take the classes right now in high school. You have an opportunity.